New York and on the new Hot 97 app. Ebro in the morning on Hot 97.
Edwin Raymond, who's a lieutenant on the NYPD, he's been posting every day about what he's seeing on the front lines, what he's dealing with currently in the community, how serious things are.
Ebro was good, Ken.
How you doing, sir? Thank you for taking the time out today. I saw you post yesterday that you are seeing just seriously abnormal death every day here in New York City. In New York City. Please describe to us, because I felt like it would be useful to have you on. I know it's a heavy, very heavy conversation, but it's our duty to have it because I still feel like there's people who are not taking this seriously.
Yeah, and thank you for taking the time to do this, because I'm not understanding, why folks are not taking this serious enough. On average, we might see maybe on the high end, maybe 4 people found dead at home in a month. In one particular precinct in Brooklyn, in the last 48 hours, there've been 19. The precinct where I worked, in 5 days, I responded to 9 people dead at home. Usually that's maybe once a month for me, so even once a month, mentally you got to reset. Because I kind of take this stuff home. That's how I stay dedicated to the people. So when you don't get to reset, you're just going from body to body to body, it starts to take a toll on you. And I keep seeing too many folks outside, too many folks not taking it serious enough,
And when you describe dead at home, we talked yesterday, it's a tough time because you have family members who are sick and in quarantine. They are by themselves because other family members can't be around them. That's what you're talking about. People who had to suffer and die by themselves at home. Yeah.
A lot of times we're not too sure of how they contracted. Many times they all have been with someone. I'm limited in what I can say, but people are outside that shouldn't be. People who are outside are coming around older folks, coming around folks with pre-existing conditions. You understand? And
you're talking about healthy young folks bringing this virus home to their older family members and neighbors.
100%. They're asymptomatic. They're not feeling any fever. They don't have a cough. They think they're good, and they're out there chilling like it's any just another Wednesday. But then when they go home, they don't realize someone that's more susceptible to the virus, in a damaging way, that they're spreading it that way. People, we need to find a way to educate folks more about why this is serious, man. There's a lot of misinformation out there. When I stop young men and women in the street, I say, "What's going on? Why are you out here?" Too many of them are out for non-essential reasons, and they're saying, "Oh, I'm black, I'm good," and it's like, no. There's ideas that if you're young or if you're a certain ethnicity, that you can't be affected by this, and people need to wake up and realize
they on Instagram too much. They listening to the jokes and they think the jokes are real.
Pretty much, yeah. And we need to change that. We need to change that mentality, because that's the only way we're really going to flatten this thing to the point we can start getting our society back little by little.
What, as far as working for the NYPD, what exactly is the NYPD doing as far as finding individuals who are having gatherings or seeing people, gathered in the park? What exactly are you guys, what's the policy?
So in terms of businesses and certain venues, officers are doing inspections. But in terms of individuals, for the most part, the fines, we're actually not trying to go there, but we have to be able to if we're going to get some type of compliance. If we have nothing it can't be toothless, unfortunately. But honestly, bro, I don't want folks we shouldn't have to need law enforcement to know that we got to take care of ourselves and look out for each other. That's where my mind is. I shouldn't even have to respond to some of the things I'm responding to. The folks walking the streets, I wish I didn't even have to approach them and tell them, ask them what they're doing. But in terms of the fines, again, it's a last resort. I'll tell you what it is. So it's a last resort type thing. It's not like officers are out there hunting to find people. We're actually looking to not have to do that at all.
Well, and also you guys are trying to not get close to individuals if you don't have to either, because you don't want to have to bring this COVID home to your families.
that's a big part of it. Thousands of officers are out sick. I think we're over 1,000 now that have been found positive with COVID. So that's definitely part of it. Unnecessary contact. Because as a first responder, as an essential worker, we really can't practice social distancing. The nature of the job, certain situations, I got to get in there. We had fires last night. We had people shot last night. I got to break that distance and do my job. You understand?
Unprecedented times. His name is E. Raymond. He's a lieutenant with the NYPD. Thank you for your time today. And anybody out there that's hearing this conversation, please take COVID-19 very serious. As you can see, it's affecting everybody. And, other than stay in the house and stay away from people, I don't really know how to impress the level of importance on individuals.